So good evening. I'm Russ Binder, the Vice President of something here, I guess IT or something, at Active Claremont. About a year ago, I went to a Claremont City Council meeting, and I usually go there looking for folks to speak on my podcast. Our guest tonight stood up, spoke up, and I knew right there I had to have her on my podcast. She came on to Claremont Speaks about a year ago and hit it out of the park. And I thought when we had an opening here at Active Claremont, she would be the perfect speaker. She is a registered nurse. You are within like 1 credit of your master's degree? 6 months. 6 months of getting your master's degree. And I'm going to let her do the rest of the introduction. But the only risk here tonight is an addiction to getting more information and more knowledge about the topic at hand. May I introduce to you Mbengue? Please come up.
Hi, everybody. Thank you so much for having me here. I'm really excited to give some facts and education and break some stigmas. Who here has never used cannabis or CBD ever? Right. Awesome. My favorite. Maybe they're my favorite. Okay. So we're just going to go over like some cannabis basics, like just basic parts of the plant. Like what does CBD do? What does THC do? We'll go over a little bit of history. And then the endocannabinoid system, the system that we have in our bodies that interacts with the cannabis plant. And we have a cool video for that. So this is the outline, history, the ECS. We're going to go over cannabinoids, routes of administration, and Q&A. Feel free to raise your hand and ask questions as we go. I kind of like it to be casual and interactive. Hey, this is a little bit about us. As Russ said, my name is Mbengue. I'm a registered nurse. I've been a nurse for 11 years now. I've worked oncology at Johns Hopkins Hospital. That's where I started my career. I've done labor and delivery. And then most recently was hospice. I'm nationally certified in all 3 of those specialties. I started cannabis about a year and a half ago when I saw the need in hospice patients, especially they needed somebody to help guide them in using cannabis appropriately. And there was no local resource to do that. So I said, I'm going to be that resource. So I jumped in the deep end and started learning everything that I could because we don't learn this stuff in nursing school yet. Although the American Nurses Association just delegated cannabis nursing as an official specialty like a couple of weeks ago, which is huge because now the cannabis industry and the healthcare industries are officially bridged where that has not been done yet. So I started Trusted Canna Nurse and we've grown over the last year and a half and we now have a whole team. So we have a nurse out of Texas. She's the one who sees most of the patients. She's our director of patient care services. And she runs our microdosing program. So we teach people how to use cannabis as medicine. And then we also do microdosing programs of psilocybin. And then we have Jana Champagne. She's our pediatric nurse specialist. She's an autism specialist and sees most of our children who have autism. And then we have Brandon Simmons. He's my brother, if you can't tell. And he's our pharmacist. He runs medication interaction. He's my free family labor. So like I said, we do cannabis consultations. We have microdosing programs. And then I started my own line of CBD products when I started doing this and I wanted to recommend quality CBD to patients and I couldn't find quality. So I said, I'm going to do it myself. So I formulated my own line. We have high quality gummies and tinctures and topicals. And then we also have suppository. Okay, let's talk about a little bit about the history of cannabis and prohibition. So up until the 1920s, cannabis was routinely prescribed by physicians. It was in the U.S. Pharmacopoeia for like 90 years up until 1947. Then came along Harry Anslinger, who is in charge of the Department of Narcotics, I believe it was. His department was in charge of alcohol prohibition, which obviously failed. And he was going to lose his department and lose his job. So he literally had to find another substance to prohibit. So he decided on cannabis and changed it to marijuana. as a way to demonize it and associate it with Black and brown people at that time. So he kind of launched this reefer madness campaign. And even though there was no evidence to support it, physicians really liked prescribing cannabis because it was a safe and effective medicine. But he went on this campaign, and it was successful. And the Marijuana Tax Act of 1937 passed, making it really difficult for anyone to get cannabis. And then from there, then we start to see the emergence of big pharma. And then in 1972, Nixon makes it Schedule 1, which means no accepted medical use and high potential for abuse, despite evidence against that. So here we are today. It's still Schedule 1 federally. However, the states run their own programs. And of course, there are many states that are both have medical programs and adult use programs. This is my favorite chart. This is when I first saw this was literally like my eye opener. Like, you've been lied to this whole time. In nursing school, we learned that marijuana and cannabis were bad. This is comparing like the lethal dose and dependence level of psychoactive drugs. So in the top right corner, we have the highest potential for lethal overdose and addiction. And then in the bottom left is almost zero potential for lethal overdose and dependence. So you can see LSD and psilocybin carry virtually no risk of those. And those two are substances that are Schedule 1. And then marijuana carries about a 9% dependence rate, but it's virtually impossible to lethally overdose on cannabis. Yes. That would be probably like around the morphine area. Yeah. Depending on the dose and the amount of like opioid in there. And then you see that we have caffeine, alcohol, and nicotine, all things that are sold at a gas station are more dangerous than things that are Schedule 1 and illegal. Okay. Now let's talk about the endocannabinoid system. This is a really great 3.5-minute video that explains it much better than I can.
And medicinal properties. Ancient Hindu texts claim it was brought by the god Shiva for the pleasure of cannabinoids, which are most abundant in the resin glands of budding female plants. In the 1960s, Israeli scientist Raphael Mashul isolated THC, the psychoactive cannabinoid that makes users feel high. The discovery launched a new chapter in neuroscience. Cannabis opened a window into the functioning of our body. Completely unexpected window, because what was discovered was that THC binds to receptors in the brain and outside the brain. And when it does so, when it binds to these receptors, the cells now behave differently. Cannabinoid receptors, named after cannabis, are found on nearly every organ in the body. They bind with our own cannabis-like molecules called endocannabinoids, which regulate functions like sleep, cognition, memory, and mood. Unlike other brain chemicals, they travel backwards across the synapse, where they control the release of most neurotransmitters.
One of the most amazing things that happened was the discovery of the endocannabinoid system. Every mammal has one. And this is a system of chemicals and receptors throughout the brain and body. And really, the primary goal of the endocannabinoid system is homeostasis, keeping things in balance.
At Mount Sinai Hospital, neuroscientist Yasmin Herb remembers the first time she looked for cannabinoid receptors in the human brain. Seen here in vivid red, orange, and yellow colors.
The cannabinoid receptor is the most abundant receptor in the brain. When we looked at where these receptors were expressed, they're expressed in brain regions relevant for motor coordination, cognition, memory, emotional regulation, reward. All of these brain areas are key to so many normal behaviors, obviously, but also psychiatric disorders as well.
Key role of the endocannabinoid system is to manage stress. In fact, the first endocannabinoid found in our body was given a Sanskrit name, Ananda, meaning bliss.
In response to stress, our body mobilizes an endocannabinoid signal. And so if something aversive happens to us and we suddenly see a threat in front of us, our body kind of goes into a high alert mode and we shoot up. Once we've been removed from that threat, though, our body needs to turn that stress response back on. And what we have learned is that this burst of endocannabinoids that occurs in response to stress is really critical for that recovery phase.
Scientists suspect this signal goes awry in people with PTSD. And that's why THC, which mimics our own endocannabinoids, might help.
Fascinating stuff. All right. Does anybody have questions on that? A lot to take. Okay. Now that you know we have an entire system in our body that interacts with the cannabis plant, there we go. Let's talk about the different parts of the cannabis plant that interact with our system. And we'll get into this with THC, but just think of the endocannabinoid system as like the volume button on our body. We have the stress response, we release cortisol, all these stress hormones, and then we have endocannabinoids or cannabinoid from the plant like THC or CBD, and that turns the volume down on that stress response. So that's just kind of like the overall big picture action of that on inflammation, pain, sleep. Okay, so when we have a cannabis plant, a beautiful looking cannabis plant like this, it's more than just THC and THC and CBD. So we have the grandmother of all cannabinoids is CBGA, is what all plants start with. And then with time and maturation, it divides out into THCA, CBDA, and then all of these other cannabinoids. So just so you know, when you're looking at the plant, you're looking at so much more than CBD and THC. And each of these have a different function in our body. So we're going to go over a little bit of it. I'm going to try to keep it as simple as possible. Okay, so first we have the acids, THCA, CBGA, and CBDA. So this is like raw cannabis. If you're to take a raw cannabis or raw hemp plant, you're getting these acids. And these acids have a lot of therapeutic potential. Okay, so THCA, if you're just to eat some raw flower or maybe make a tea out of it, it has lots of anti-inflammatory properties, and it's not going to get you high unless it converts to THC. When you have a joint or when you have raw bud, before you smoke it, that's all THCA. And then when you smoke it and heat it, that's when it converts to THC. So just know that when you're looking at something, you might see THCA on the market, on the internet, that you can buy THCA. That's just like regular marijuana. That's regular cannabis. Because when you smoke it, it converts to THC. And then CBDA and CBGA have great anti-inflammatory properties. In a petri dish, it was found to bind to the spike protein on the COVID virus, preventing it from entering the cell. And some research just came out on patient outcomes from people who were hospitalized with COVID, and they found that people who used cannabis were had very statistically significant different outcomes. So they were less likely to be intubated, less likely to die from COVID, less likely to go into sepsis, respiratory failure, all of those things that caused issues. Right? And it's because of the anti-inflammatory action of cannabis. Part of that. Okay, THC, everybody's favorite molecule. So this is the only molecule in the plant that actually causes that psychoactivity, we'll call it. And that's because it binds to our CB1, or cannabinoid 1, and cannabinoid 2 receptors. CB1 receptors are primarily in the brain. CB2 receptors are primarily in the gut. It does have what we call a biphasic dose response, meaning a low dose is good, a high dose is not so good. And we'll go over that later with a little bit of a graph. Like I said, it carries a 9% dependence rate. Those, about 9% of people who utilize cannabis can become dependent. But those are usually people who don't have any other stress relieving tools. Maybe they're turning to some sort of substance, whatever it is. It could be caffeine. It could be opioids or something to help deal with their stress or their trauma. And sometimes that's cannabis for those people. And THC can be great for chronic pain, nerve pain, anxiety, stimulating appetite, insomnia, cancer. Cannabis and THC have great anti-cancer properties. So it's not only helpful for like the symptoms of cancer, like the pain and the appetite, and the things associated with chemo, but it also has anti-cancer properties and can help kill cancer. So there are protocols out there for actually treating cancer with high doses of THC. Autism is a huge one. Kids with autism have been found to have deficiencies in their own endocannabinoid system. So filling that gap with THC and CBD can be really therapeutic for kids who struggle with autism. It depends. It depends on, okay. Oh, all right. So the question is, how are we giving, children with autism? How are we giving them cannabis? And it really depends. Our preference is like a high quality oil that's extracted and it's like the most raw form that we can get. But otherwise, a lot of them you choose to use gummies or, like I said, oils. Sometimes a transdermal patch can be effective. But yeah, the same way that adults, or people without autism would use it. Alzheimer's and dementia, nausea, vomiting, migraines, and there are many, many more illnesses and conditions that can benefit from THC. Side effects of THC. Like I said, you can't lethally overdose from THC, but that does not mean it's without side effects. So drowsiness is one, which makes THC fantastic for those who suffer from insomnia. Dry mouth. If you've ever smoked and had dry mouth, and that's because it's turning the volume down on our saliva gland. So causing a dry mouth. The red eye, short-term memory loss, and then a transient increase in heart rate. And then this is what I mean by the biphasic dose response. So you'll see that, a low dose, super low dose may have low benefit, and then people gradually increase their dose until they have reached their optimal dose or like their therapeutic window. For some people, that's 1 milligram of THC. For some people, that's 20 or 100 because everybody's endocannabinoid system is different. And then if you've overdone it, if you took the second gummy because you didn't wait for that first gummy to kick in, everybody had the gummy story, then you can go into the red zone where you're having anxiety, paranoia, nausea, vomiting. Do you have a gummy story? But nobody died, right? Okay. And then we have CBD. So unlike THC, CBD does not bind to those CB1 receptors in our brain, but it binds to 65 different receptor sites throughout our body. So we call it psychoactive because it does impact our mood. It binds to serotonin receptors, so it can improve our mood and then decrease our anxiety. And this one is generally well tolerated at very high doses without side effects. And there's CBD can also help with the same things that THC can help with. Chronic pain, nerve pain, anxiety, insomnia, cancer, autism, depression, all of those things too. But why would somebody use THC when CBD works on the same things? And it's because CBD works well, but when you have a small amount of THC, it works even better. And that is backed by research. All right, CBG. This one is starting to come out as very popular cannabinoid. This is called cannabigerol. And what's really cool about CBG, I got one up here, is that it binds to receptors involved in our fight or flight response. So just like the medication clonidine, and the ADHD med guanfacine binds to the same receptors. So people who take CBG find that it can help with focus. It can help with those physical symptoms of anxiety. And then it can inhibit the uptake of GABA, and GABA is our calming neurotransmitter. So CBG can be really, really great for anxiety. And then IBS and gut issues, and that's because it binds to receptors in our gut, decreasing inflammation, neuroinflammation in the brain, and like I said, focus, and ADHD, and then cancer. Also has anti-cancer properties. I'm just going to go through CBN real quick because you will see CBN on the market. Over time, THC degrades to CBN. CBN, they say it's not psychoactive, but CBN is marketed for sleep. So just think CBN for nighttime. There is some research that is coming out that supports CBN for sleep, and some that doesn't. So just so you know, when you go to a dispensary, CBN is marketed for sleep, works for some people, may not work for other people. It's non-psychoactive also. THCV. This is a really, really interesting one. So where THC kind of turns on those receptors, THCV opposite of those receptors. So a lot of people feel their appetite is suppressed when they take THCV. And there are lots of studies coming out on THCV and its potential in treating diabetes, obesity, metabolic disorders. And then it's also showing potential for Parkinson's and addiction. I'm finding that THCV is also helping people with focus too. And just so you can see the difference between THC and THCV in their structure, it's just like the little tail on the end of the molecule. Okay. Routes of administration. There are a few more than this, but these are the main ones that we'll talk about. So we have inhalation, ingestion, topicals, sublingual, and suppository. Everybody's favorite. Okay. So inhalation, of course, like this is the most popular one. And there are many benefits to smoking and inhaling. This is when you need something fast acting and short acting. Inhaling either through a joint or using something called a dry herb vaporizer. This just heats up the flower to so that you're inhaling almost like steam, and it's not combusting. It's really gentle on the lung. And then we have the popular vape pens that are out there. That's just really easy to grab, and then use that and go. That's great for, if you're in a situation where you can't get outside or you want to be discreet, vape pens can be good. Some are better than others. Some have more chemicals than others. So you do have to be mindful of what you're actually putting in your body. As far as long-term effects of smoking, it's not going to lead to lung cancer. It's not correlated with an increase in risk of lung cancer. Chronic long-term smoking can lead to bronchitis, that goes away after cessation of smoking. But otherwise, people with COPD, they've studied that in COPD, and those patients did really well. It can work really well in patients with COPD because it acts as a bronchodilator, and in asthma as well. And it can help dry up secretions in the chest. With asthma, we use cannabis for asthma before we had albuterol because it dilates our bronchioles. So Drawback, like I said, higher risk for future lung issues, and it's short-acting. So it usually only lasts a couple hours. So if people have insomnia issues where they're waking up in the middle of the night, then they probably want to do a gummy or something longer acting instead of inhaling. Any questions on inhalation? Yeah. Mm-hmm. Right. Right. I know that with concentrate for people who are like, I don't know if you know what dabbing is. That's like using a concentrate and using this whole rig. They did a study on that, and at super, super high temperatures, that did convert some of the terpenes to benzene, which is a known carcinogen. However, people aren't inhaling at those temperatures. When you're combusting anything, it can potentially cause issues. But that's kind of the theory is that that's canceled out by the anti-cancer properties of cannabis itself, as CBD and THC. So that's why we're not seeing an increase in risk of lung cancer with smoking. Mm-hmm. Yeah. We're not seeing, with chronic heavy use, people doing it multiple times a day, like for months or years, we are seeing like some lung issues, but we're not seeing cancer in those patients. Okay. Then we have ingestion. So this is your brownies. This is your gummies. You're going to have to tell a gummy story now. So when you take a gummies are fantastic for sleep, but you have to take them 1 to 2 hours before going to bed, because that's how long it takes for them to kick in, because they have to be digested and processed through our liver. So that's why we don't take the second gummy. When they go through the liver, THC is converted to something stronger called 11-hydroxy-THC. So that's why like a 5 milligram gummy could hit harder than the same amount that you smoke. And that's because it's converted in the liver to something a little bit stronger, which is also what makes it great for sleep, because it's just a little bit stronger. And they typically last 6 to 10 hours. If you're eating a fatty meal, then it can, because cannabis is an oil, and it's absorbed, with fat, it's absorbed better with fat. So if you're eating it with a fatty meal, it's going to hit even stronger, but it will also take a little bit longer and last a little bit longer as opposed to an empty stomach. And then, like I said, better for sleep, or if you're taking something low dose, it's great for long acting. Like if you need something long acting for pain, you take like a low dose gummy in the morning, and then as needed inhalation throughout the day. Do you want to tell your gummy story? Okay. All right. And then we have topicals. So these are your balms, your lotions, your roll-ons. You could even take like a tincture and put it on your skin. We do have cannabinoid receptors on our skin and other receptors on our skin that interact with cannabinoid. So for the most part, it doesn't absorb into the bloodstream. So we're not worried about like urine tests or getting high or anything when we're using a topical. Can be great for joint pain. My whole family has knee issues, so they use our topical for their knee issues. For something like a deep hip issue, it's probably not going to penetrate deep enough, but joint issues and skin issues as well. Mosquitoes. CBD can be great for those mosquito bites. Yeah. Russ asked if there's a topical that would be good for inflammation, like underneath the skin, inside the muscle. Mm-hmm. He said if he puts it on his knee, will it help inside the knee? Well, it's not going to help inside the joint, but it can help support the inflammation that is surrounding the knee. So people with knee issues do really well with we have one balm that has CBD and CBG in it, and it works wonders for joint pain. Minimal side effects unless there's some sort of skin allergy or something to one of the ingredients. And then like I said, great for joint pain and skin issues. My 4-year-old had the eczema issues, and we put CBD on his skin all the time, and he will ask for it when he's having issues. Okay, then we have sublingual. That means under the tongue. This is most of your tinctures and oils. This is most of the CBD oils on the market. So, absorbs through the blood vessels under the tongue, and whatever doesn't get absorbed there gets swallowed and absorbed through the stomach. And then this is great for either routine or as needed dosing. And most CBD or hemp oils out there on the market that are sold nationwide are tinctures. And then you can get different combinations of cannabinoids and terpenes. So you can get THCV and CBD and CBG and stuff that it's hard to find at a dispensary, because most dispensaries, especially in California, where it's a very recreational market, it's mostly high THC. On the hemp side, and the CBD side, then you can get different combinations. So we have a tincture that's CBD plus CBN and CBGA plus CBG and THCV. So we can have all of these different combinations that have small amounts of THC, but then different combinations of different cannabinoids in oils that go under the tongue. They last 4 to 6 hours. And it can be great for just routine dosing or as needed dosing. Any questions on oil? Okay, everybody's favorite, suppositories. So suppositories are great for getting relief to where you need it. So a lot of women with period pain, painful sex, cramps, those kinds of pelvic issues, even lower GI issues, suppositories can be great for that. And I have questionable absorption here because we don't know yet if they absorb into the bloodstream. There are people who are treating cancer with, they're using high THC suppositories to treat their cancer. They're putting hundreds of milligrams of THC in a suppository and using that, and it's healing their cancer. But we can't do research on suppositories because it's considered a medical device. So that's why we have all this research out, but we can't do research on suppositories because it gets inserted. So, great for menstrual pain and cramp. And then, this is preferred for people who are often using high THC, to treat their cancer. I have a 9-year-old in Arkansas. She has Ewing sarcoma, which is a very aggressive type of cancer. And, my brother will make suppositories for her that have, CBD and CBG. And then she makes her own THC suppositories. And she's been doing that. She did that alongside her chemo. She lost minimal weight. She never had to be admitted for fevers during her treatment. She handled radiation really, really well. And she's no evidence of disease, I think going on 6 months now. So cannabis can be great. Suppositories can be great also. And we will be launching, a study on suppositories and pelvic pain and menstrual cramps for women coming up in the next month or two. Okay. Let's just attack some myths and why your CBD might not be working. If you have tried CBD before, most effective CBD has a small amount of THC in it, not enough to get you high, but it creates what is called a synergistic or entourage effect. So they all kind of work together to help pain, inflammation, anxiety, and all the things that you're treating with your CBD. Terpenes. We didn't talk about terpenes tonight, but terpenes are part of what gives cannabis its smell. If it smells like a skunk or if it smells like pine sol, those are terpenes that you're smelling. And those have different effects as well. And terpenes are nature's medicine. When you're going for a walk in a pine forest, you're inhaling the terpene pinene. When you're smelling lavender, you're inhaling the terpene linalool. And those are very concentrated in cannabis, and they have therapeutic and medicinal effects as well. So you can kind of create, we have different CBD tinctures with targeted terpenes if we want it to be uplifting or if we want it to be more relaxing. then we can create those cool formulations and make it even more effective. And then, of course, with CBD, if it didn't work, you didn't give enough time. CBD is a quiet medicine, meaning that it works slowly over time to bring down the body's inflammation. Some people will feel relief right away, if it's a great tincture, but other people, they'll notice after like a week or two, like, oh, this thing usually used to hurt me when I walked up the steps, but it doesn't hurt like that anymore. So you have to give it time to work. And then myths about cannabis, stuff that you guys may have been taught, stuff that I was taught. Cannabis will make you go crazy. This is not true. That was reefer madness and propaganda. And there are instances of people having those adverse side effects when they've gone into that red zone. But otherwise, if you're sticking at the low dosage, that's usually not going to happen. A lot of doctors will say there's not enough research on cannabis, and that's why they can't recommend it because there's not enough research. But they're kind of telling on themselves because cannabis is the most studied drug in the world. There are over 35,000 peer-reviewed papers written on it, with over 5,000 coming out each year. So, of course, we need more and better research. We have been prohibited from doing quality research because of its Schedule I status, but there's plenty of research out there to support its use. And how many times do doctors prescribe drugs for off-label use that we have no evidence on, and prescribe drugs to women when all of the clinical trials were done on men? So we have plenty of research on cannabis and CBD to support that it's both safe and effective. Another myth, cannabis is highly addictive, 9% addiction rate, or dependence rate, which is less than caffeine, nicotine, alcohol, and of course, the other harder substances. And then another myth is that you need a doctor clearance or a prescription. I get this from a lot of patients. Okay, let me check with my doctor. I'm like, your doctor is going to say no because they don't know, right? So you guys have the right to choose to use cannabis and CBD. You don't need a doctor's prescription. You don't need doctor clearance. Of course, it's great to have them on board with it and make sure it's not going to interact with medication. There is a small risk for interaction with some meds, but otherwise, you guys have the right to choose. So feel empowered. And that is it. Who has questions? Yes. Yeah. Great question. So the question was, you had heard from Cal Poly that, in general, you heard that, the cannabis grown at scale could be filled with like pesticides and great question. So cannabis is, what's called a bioaccumulator, which means that it soaks up everything from the ground. So it can soak up heavy metals and pesticides, and there could be solvents left over from the processing of the gummies. California has pretty strict laws for dispensaries that it has to be third-party tested for mycotoxins, pesticides, solvents, all these things that we don't want to be consuming. There's a whole panel. So, of course, growing your own, you know that you're getting good quality, and the best quality, I think, is homegrown cannabis. But otherwise, the second best would be legally from a dispensary as opposed to some place off the street or, wherever else you could get it. But I feel safe consuming dispensary weed. Yes. Yep. The question was on third-party lab testing. Yes. All cannabis sold in dispensaries in California has to go through rigorous third-party lab testing. So, yeah. Right. Okay. So the question was, what is like the effect if we have one too many brownies? Well, if you're at a place, first of all, like, we can address like the whole, I don't know if you were like alluding to the fentanyl thing with that at all. Okay. All right. You can leave that off the table. But with brownies, and if we are consuming too many because you don't wait that 1 to 2 hours for it to kick in, then we can go into that red zone and you're just going to be like, can be really uncomfortable. Symptoms can include anxiety, paranoia, sometimes hallucinations. Some people just kind of lose touch with reality, for that time, and they just have a bad time. Some people just pass out and just sleep it off. There have been hospitalizations or people going to the ER because they're having all of these like really uncomfortable side effects. Again, nobody has died from a THC overdose. So yeah, when going to a party, if the intention is to, just be high and enjoy yourself, then maybe we don't do a brownie. Maybe we just do like smoke a joint, just to like relax. Cause usually brownies, again, that converts to that stronger THC that can be really sedating and just make us really sleepy. And that's no fun at a party, Did that answer your question? Sorry. Yeah. Okay. The question was, in hospice, are we using it with morphine or in place of morphine? So cannabis and so THC and opioids can actually work really, really well together. A lot of pain clinics will like fire their patients if they test positive for THC, which is illegal to do in California. A lot of clinics are still doing that, but that's illegal to do. But patients can actually keep at a lower dose of opioid when they have THC added in because of that synergistic effect. So in hospice, we kind of, I left before I really had a chance to like do this kind of work. And also my hospice was not supportive of it. There's a lot of stigma because it's funded by Medicare and it's federally illegal, but education is never illegal. And we have the right to teach our patient to use this medicine. Hospice isn't paying for it, but we can send the family to the dispensary to get it. And then it can work really well with the morphine or in place of the morphine. And that way patients are like awake, alert, like smiling and laughing with their families instead of sedated on the morphine. So it can be really effective. Other questions? Yeah. Mm-hmm. Great. So the question was basically on dosing of edibles, a newbie versus somebody who's used for a while. So when people are starting to use gummies and edibles, just make sure I tell them, look at the package and make sure you know how much is in each gummy. And all of the packaging in California is supposed to say it, but sometimes it's hard to find. I would say, as a nurse, I can't tell you what to dose. However, most people like to start with less than 5 milligrams their first time. 2 to 3 milligrams is a great starting point for a lot of people. Then if you don't feel anything, then okay, you tolerated it well. If you felt something, you had a great night of sleep, then you don't need any more than that. And I always recommend, the first time you're at home, you're not, of course, not getting on the road after that. And you're in a safe space so that you don't have anything big going on. And then for people who have used for a while, you can build up a tolerance to THC. And a lot of people do have a high tolerance to THC. Those are the ones who are using chronically every day, high doses. Tolerance breaks can be really effective, for those who have to use every day, to take a break 1 to 2 days a week, to reset those receptors. But some people have a high tolerance and can take a 100 milligram gummy, and that would knock me out for a week. But some people do have that high tolerance. And some people, there's a small percentage of the population that don't feel edibles at all. They could eat an entire bag of gummies, and that's because they have a liver enzyme abnormality that just doesn't process the THC. So there are people out there like that. Did that answer your question? Go for it. I think that's a great gummy. Those are hard to find. Yeah. So the gummies that we have 30 milligrams of CBD and 5 milligrams of THC. And then we have another gummy that's exactly half that. And those are CBD and THC work really, really well together because they work on separate receptors, but they can also help each other to work better too. Kind of. So yeah, when you have too much THC and you need to come back down, then CBD is one of the things that has helped people come back down from that. As far as having the split, I think that's just a really good therapeutic option to help with, pain, anxiety, all of the issues that you're trying to manage with it. And I think in the California rec market, it's hard to find that equality between the two because that is more medicinal. That's going to take you less high than something that's straight THC. So, but the combo is I recommend. What were your other questions? Mm-hmm. Mm-hmm. Great question. Well, it's not anything that is FDA approved. And for it to be FDA approved, it has to go through that process. And, the FDA, cannabis is considered a dirty drug because it interacts with so many receptors on the body. And, so what the role that Big Pharma would play in this is they would strip away the hundreds of different chemicals in the plant to one single chemical and then test that. But you can't, and then patent it, of course. Like they have to have IP. They have to be able to patent it in order to make money from it and then go through the FDA process. So that's kind of where we're at and why we don't have like these guidelines. But yeah, I would say, I mean, what I tell my seniors is like, start with 3 milligrams or less. Some people start out with 1 milligram and then see how that goes. But yeah, it's a whole FDA big pharma thing is why we don't have national guidelines on this, I think, in my opinion. And also everybody is different. Everybody's different. And there are no requirements for a medical professional to be in a dispensary, which is really unfortunate. I reached out to multiple dispensaries to work with them to teach their bud tenders to be a nurse on site and nobody was interested. So it's, yeah. Yeah, that would be great. I just don't know who would put out the guidelines. Is it the FDA? If it's the FDA, then that means they actually have to approve it and they have to like deschedule it or move it to, a different schedule, which they're currently fighting about that. So I think that means the federal government would have to acknowledge its therapeutic benefit and then make some move. Then that would be wonderful. I don't know when or if that will happen. Yeah. Great question. The question was, would having a nurse on staff help make dispensaries more palatable in Claremont? And you guys tell me, it sounds like a great idea. However, dispensaries are expensive and expensive to run. And, the profit margins are actually low for the most part in dispensaries. It's expensive to grow cannabis. They are taxed beyond belief. So we're looking at a total of 25% tax rate. So there's not much room for a nurse in that budget. And I recognize that. And that totally sucks. But it would be great if we had people who were informed and educated and making more than minimum wage behind the counter, helping people use it as medicine. I love that you went to 3 dispensaries to check it out. What was your favorite one? Right, right. Yeah. And so the question was, about medical claims and using certain words in dispensaries and you will see on the CBD market, you will not see any sort of medical diagnosis. You won't see the words anxiety or inflammation on next to products because the FDA will come down hard because they'll say there's not enough evidence. We are unaware that CBD can help with inflammation. So, and in dispensaries, they have to be really careful. They may say this may help with sleep, or it has helped other people with sleep. They can't use medical diagnosis. They can't say, oh yeah, this helps with Parkinson's or this helps with diabetes. So there is a lot of hedging that has to go on because the FDA could come down hard and shut down places that are using those medical diagnoses. And in California or Canada, they're even more strict. They can't even say sleep. They have to say, this is for nighttime. The restrictions that are placed on us in terms of like what we can verbally say are a lot. Any other question? Excellent. So we have, for our products, we have a great product line, and you can make, a free product guidance call, make an appointment for a free product guidance call where you call and talk to a nurse, and we kind of guide you through which of our products you think would be best for you. We do full consultations if you want us to take a look at medications and everything else that could help. And then we have microdosing programs for people interested in microdosing, which is kind of the new wave in mental health. I live at Webb, but so that we're all e-commerce, and like my team is all around the country. So yeah. All right. Thank you guys so much for having me.
Always helps. Megan, thank you very much. You once again hit it out of the park. And in recognition of that, we don't do this for everyone. I'm sorry, what? Oh. All right. Raise of hands. Okay. Bill took a wild guess as to your side. You have one of the few active Claremont t-shirts to wear proudly and sport. Oh, well, me either. They don't have a 5X, so yeah, I'm out. But not by choice. All right. No, Megan, thank you so much. As predicted, you hit it out of the park once again. I hope you'll come back again sometime when, I believe you mentioned at the Chamber of Commerce meeting, mushrooms are on the horizon. Oh, we're going to get rid of him. All right. So should that change? Yeah. Next year after the election, and he's out anyway, right? No, but okay. But we'd like to have you back sometime, and thank you for such a great presentation. And I think everybody asked just some of the best questions. So okay, and if Bill, and did you have something to nightcap for us on this? No farting shot, no nightcap, no. Okay. Well, Bill, thank you very much for the introduction, and to Active Claremont for having Megan. Megan, again, thank you for coming. And that's our show.